The information provided in this video is for educational purposes only. It is not intended to replace professional medical advice. Always consult your doctor or healthcare provider for specific concerns about medication usage and dosage. Have you ever been left scratching your head trying to decide what medication is best for your condition? A headache, a toothache, a muscle pain, or migraine? You have a bunch of medications in your cabinet and are about to reach for one. Which one is right for you? We try to answer your dilemma in this video. In a nutshell, something hurts and you want to fix it. In this video, we outline the similarities and differences between paracetamol and ibuprofen and possible reasons one will be better than the other. We list their common brand names and who makes them. We go into detail about how paracetamol or ibuprofen help your ailments, and maybe when they may not be so good, so when to avoid using paracetamol or ibuprofen. We also offer a list of alternatives and some interesting info and these medications and the companies that produce similar drugs. Paracetamol, also known as acetaminophen, versus the popular non-steroidal anti-inflammatory drug called ibuprofen. Which one should I take and why? What makes paracetamol a better option? And alternatively, when should I reach for the ibuprofen? Let's first see who makes these drugs. There are many generic versions available in most countries, and here are some of the most widely recognized brands for paracetamol and ibuprofen for paracetamol, also known as acetaminophen in some regions. Common brand names are Tylenol in the United States and Canada, Panadol in Australia, United Kingdom, New Zealand, Asia, and Africa. Calpol in the United Kingdom is marketed more specifically for children. Panamax in Australia, Dolo in India, Crocin in India and South Asia, Tempra in the Philippines and Latin America, Adol in the Middle East, Efferalgan in Europe and Latin America, and Acamol in Israel. Many more, however, you can see that paracetamol is branded and marketed worldwide under several labels to try and get customers to buy their product. However, at the end of the day, it's all paracetamol for the most part. For ibuprofen, the common worldwide brand names are Advil in the United States, Canada, and Australia, Nurofen in the United Kingdom, Australia, and Europe, Motrin in the United States and Canada, Brufen in the Middle East, Asia and Europe, Ibugesic in India, Dolomin in Germany, Bofen in Africa and Middle East, Actiprofen in Latin America, Iprin in Sweden, and Ibuprin in the Philippines. The top producers of paracetamol, also known as acetaminophen, include Johnson & Johnson with the brand Tylenol in the United States and Canada. Tylenol is one of the most recognized over-the-counter OTC pain relief brands in the world. GlaxoSmithKline, GSK, produces the brand. Panadol in the United Kingdom, Australia, and Asia. Panadol is marketed globally as a fast and effective solution for pain relief and fever reduction. Reckitt produces the brand Lemsip, which contains paracetamol in some versions, in the United Kingdom and Australia. Lemsip is widely used for cold and flu relief, combining paracetamol with other ingredients like decongestants. Top producers of ibuprofen include Pfizer under the brand, Advil in the United States, Canada, and Australia. Advil is one of the most well-known ibuprofen brands worldwide, heavily marketed for fast pain relief and anti-inflammatory benefits. Reckitt produces the brand Nurofen in the United Kingdom, Europe, and Australia. Nurofen is one of the leading ibuprofen brands in the UK and Australia, offering a variety of formats like gel capsules and topical gels. Abbott Laboratories produce the brand. Brufen in the Middle East and Asia Brufen is marketed primarily in the Middle East and Asia, and it's known for its affordability and effectiveness. Bayer produces Aleve, contains naproxen, a similar NSAID, but Bayer also produces ibuprofen products in the United States and Europe. Bayer is a pharmaceutical giant producing a range of over-the-counter pain relievers, though Aleve is more focused on naproxen. For both paracetamol and ibuprofen, China and India are the major global suppliers of raw materials, APIs, or active pharmaceutical ingredients. These countries dominate the market in manufacturing APIs, which are then processed by pharmaceutical companies into the finished drugs. Both drugs are included in the World Health Organization's list of essential medicines, reflecting their importance in global healthcare for treating pain and fever. The ibuprofen market has been growing due to its use in treating COVID-19 related symptoms, even though there was initial controversy about its safety for this purpose. This has led to an increase in production and sales of ibuprofen worldwide. All of these companies try their best to make consumers loyal to their brand, when in fact they are all just selling the same medication. Savvy buyers can simply opt for the generic brand and save some money. Of course, variations in pill and liquid form and dosage level will add to the challenge, and clever marketing is sometimes all a brand needs to get your loyalty. Best to check the ingredient list to see if the product is just a simple name change for the base medication or paracetamol or ibuprofen. You may be surprised. Paracetamol and ibuprofen are commonly used medications to relieve pain and reduce fever, but they belong to different drug classes and have distinct mechanisms of action. Here's a brief summary and comparison of the two. Summary of the drug. Paracetamol. Its medical class is as an analgesic and antipyretic medication. Paracetamol works primarily in the brain to reduce pain and fever by inhibiting cyclooxygenase, COX, enzymes in the central nervous system. There are no anti-inflammatory effects. Paracetamol has a lower risk of stomach upset and ulcers. Paracetamol rarely affects kidney function when used appropriately. Paracetamol overuse can cause liver toxicity, particularly in high doses. Dosage frequency is usually every 4 to 6 hours for paracetamol, a higher risk interaction when combined with alcohol, due to liver effects, with paracetamol. A summary of the drug. Ibuprofen, its medical class, is as a non-steroidal anti-inflammatory drug medication, NSAID. Ibuprofen inhibits cyclooxygenase, COX, enzymes both centrally and peripherally, reducing inflammation, pain, and fever. Yes, ibuprofen reduces inflammation. Ibuprofen presents a higher risk of gastrointestinal, GI, side effects such as ulcers, heartburn, and bleeding. Prolonged use of ibuprofen may impair kidney function, especially in those with pre-existing conditions. Ibuprofen has a minimal effect on the liver compared to paracetamol. The ibuprofen dosage frequency is usually every 6 to 8 hours. Alcohol can still increase. GI risks with ibuprofen usage. Why paracetamol and ibuprofen may be similar. The similarities between both paracetamol and ibuprofen include: for pain relief. Both medications are effective for mild to moderate pain, such as headaches, toothaches, and muscle aches. Both paracetamol and ibuprofen are effective in reducing fever. Both drugs are available without a prescription. Both are generally recommended for short-term use in treating acute pain or fever. Some of the pros and cons of paracetamol use. The pros for paracetamol include the following. Paracetamol is gentler on the stomach. Paracetamol has minimal gastrointestinal side effects. Paracetamol is considered safe for most age groups. Suitable for infants, children, and pregnant women under medical advice. Paracetamol has fewer known drug interactions. Paracetamol generally interacts with fewer medications compared to non-steroidal anti-inflammatory drugs. Paracetamol doesn't affect platelets. It does not impair blood clotting like non-steroidal anti-inflammatory drugs. Paracetamol has no anti-inflammatory side effects, therefore less risk of kidney damage compared to non-steroidal anti-inflammatory drugs like ibuprofen. The cons of paracetamol include the following. Paracetamol provides no anti-inflammatory effect. Paracetamol does not reduce inflammation, so it's less effective for conditions like arthritis. Paracetamol has possible liver toxicity, with overdose or chronic use can cause severe liver damage. Paracetamol provides limited pain relief for severe conditions and is less effective for pain involving significant inflammation. Paracetamol has a risk with alcohol, and combining with alcohol increases the risk of liver damage. Paracetamol has a narrow safety margin. There is a fine line between a therapeutic and toxic dose, especially in long-term use. Now let us dive into some pros and cons of ibuprofen. Let's start with what works. Ibuprofen has anti-inflammatory effects, effective for conditions involving inflammation like arthritis, sprains, or back pain. Ibuprofen is good for swelling, reduces swelling and redness in injuries or infections. Ibuprofen has stronger pain relief, generally more effective than paracetamol for certain types of pain, inflammatory pain or period pain. Ibuprofen has versatile usage. It can be used for fever, inflammation, and pain. Ibuprofen is widely available. It can be used in various forms, tablets, gels, liquids, etc. So let's dive into why you may wish to avoid ibuprofen. Ibuprofen has gastrointestinal side effects. Increased risk of ulcers, stomach bleeding, or heartburn, especially with long-term use. Ibuprofen is not suitable for everyone. Ibuprofen can worsen certain conditions like asthma, kidney disease, and heart conditions. Ibuprofen has an impact on your kidneys. Prolonged use of ibuprofen can lead to kidney damage, especially in older adults or those with pre-existing kidney conditions. Ibuprofen causes platelet inhibition. This can increase bleeding risk as it affects platelet function. Ibuprofen has a cardiovascular risk. Long-term use may increase the risk of heart attack or stroke in some individuals. To summarize, let us outline when paracetamol is likely better. This includes people with a sensitive stomach. Paracetamol is less likely to cause GI upset or ulcers. During pregnancy, it's generally considered safer than non-steroidal anti-inflammatory drugs, but consult a doctor. When alcohol is consumed, ibuprofen can worsen alcohol-related liver damage, whereas paracetamol is less risky unless taken in high doses. For children, paracetamol is often recommended for babies and young children as it is gentler on the body. For people on blood thinners, paracetamol doesn't interfere with blood clotting like ibuprofen can. Now, let's see. When ibuprofen is likely better. This includes inflammation-related pain. Conditions like arthritis, sprains, or muscle injuries benefit from ibuprofen's anti-inflammatory properties. For menstrual cramps, ibuprofen's anti-inflammatory effects make it more effective for period pain. For sports injuries, swelling, redness, and inflammation from sprains or strains respond well to ibuprofen. For toothaches, ibuprofen can address both the pain and inflammation involved in dental pain. For back pain or joint pain, inflammatory pain in joints or muscles is better relieved by ibuprofen due to its dual action on pain and inflammation. Alternatives to paracetamol and ibuprofen. If you prefer to avoid taking paracetamol or ibuprofen, here are alternative medications for pain relief and fever reduction, listed in order of similarity to these two drugs. Aspirin, or acetylsalicylic acid, is most similar to ibuprofen, as both belong to the non-steroidal anti-inflammatory drug class. Uses include pain relief, inflammation reduction, fever reduction, and prevention of heart attacks at lower doses. The key differences are it has more significant blood-thinning properties than ibuprofen and can irritate the stomach lining more easily. Common brands include Bayer, Anacin, and Bufferin. Next is naproxen. Naproxen is similar to ibuprofen as another NSAID, but with a longer duration of action. It requires fewer doses. Uses include pain relief, especially for arthritis, inflammation reduction, and fever reduction. The key differences show naproxen is longer lasting, but may also be harsher on the stomach and kidneys with long-term use. Common brands include Aleve and Naprosyn. Diclofenac. Similarity. Another NSAID, similar to ibuprofen, is known for treating inflammation and moderate pain. It is used for treating conditions like arthritis, migraines, and post-operative pain. The key differences are diclofenac is generally stronger than ibuprofen, but carries a higher risk of gastrointestinal and cardiovascular side effects. Common brands of diclofenac include Voltaren and cataflam. Next is acetylcysteine, combination alternatives for cold relief. Similarly, acetylcysteine is CD as part of combination cold and flu medications that often also contain paracetamol, but some versions do not. Primarily, acetylcysteine is used in cold relief medications to reduce mucus and congestion, sometimes combined with mild pain relievers. The key differences are acetylcysteine does not have the same standalone pain-relieving and fever-reducing effects as paracetamol, but can help with symptom management in cold and flu. Then there's tramadol. This is a pain reliever, but chemically different. Tramadol is considered an opioid-like pain medication and is used for moderate to severe pain. Tramadol is used in pain relief, especially for more intense pain that NSAIDs and paracetamol cannot alleviate. Key differences include tramadol is a prescription medication and has a higher risk of dependency and side effects compared to NSAIDs and paracetamol. Common brands of tramadol include Ultram and Conzip. Codeine, also in combination with other analgesics. Codeine is often combined with paracetamol or ibuprofen in certain medications, for example, cocodamol, providing stronger pain relief. Codeine is used for moderate to severe pain relief and often prescribed when pain is not managed by over-the-counter options. Codeine is an opioid, so it is stronger than both paracetamol and ibuprofen, but also comes with a higher risk of dependency. Common brands include Tylenol with codeine and Panadeine. The combination of acetylcysteine plus phenylephrine for treating cold and flu symptoms, found in cold and flu medications with paracetamol alternatives. This combination helps relieve congestion and mucus buildup, but does not have strong pain-relieving properties. Used for congestion relief, cold and flu symptoms. Key differences include not being a direct replacement for pain or inflammation relief. Celecoxib is a selective COX-2 inhibitor. Similarity, another NSAID, but more selective in its action, reducing the risk of gastrointestinal issues associated with ibuprofen. Celecoxib is used for arthritis, pain, and inflammation relief. Celecoxib causes fewer stomach issues than other NSAIDs, but carries similar cardiovascular risks. The common brand of celecoxib is Celebrex. The drugs gabapentin or pregabalin are used for nerve pain, not directly related to NSAIDs or paracetamol, but sometimes considered when typical painkillers are ineffective. Gabapentin or pregabalin are used for neuropathic pain, nerve-related pain, conditions like fibromyalgia. The key differences is that they work by affecting the nervous system rather than reducing inflammation or directly relieving pain like NSAIDs or paracetamol. Common brands are Neurontin, also known as gabapentin, and Lyrica, also known as pregabalin. And finally, we have natural remedies, for example, turmeric and willow bark. Similarity. Natural alternatives used for mild pain and inflammation, similar to NSAIDs but less potent. Used for mild pain relief, with anti-inflammatory properties. Key differences include their effects are generally milder and less consistent than pharmaceutical alternatives. Some examples. Willow bark contains salicin, which is similar to aspirin, and turmeric has anti-inflammatory properties due to curcumin. Each of these medications can serve as an alternative to paracetamol or ibuprofen, but it's essential to consider their differences in side effects, risks, and intended use. Always consult a healthcare provider to determine the best alternative based on individual needs and medical history. To round up the conversation, which drug is safer when comparing paracetamol and ibuprofen? In simple terms, paracetamol, or acetaminophen, is generally considered safer than ibuprofen for most people when taken at recommended doses. However, both drugs can be harmful if misused. Here's why paracetamol is often seen as safer, and a breakdown of the lesser-known harmful effects of both drugs. Paracetamol might be considered safer due to being gentler on the stomach. Paracetamol doesn't irritate the stomach lining like ibuprofen does, so it's safer for people with sensitive stomachs or ulcers. Paracetamol has potentially fewer side effects. At normal doses, paracetamol has fewer side effects compared to ibuprofen, which can affect the stomach, kidneys, and heart. Paracetamol produces no blood thinning. Unlike ibuprofen, paracetamol does not thin the blood, making it a better option for people who take blood thinners or have a risk of bleeding. However, paracetamol overdose is dangerous. Taking too much paracetamol can cause serious liver damage, and it's the leading cause of liver failure in some countries. The safety of paracetamol relies heavily on sticking to the recommended dosage. Less known harmful effects of paracetamol include liver damage, which is the most important here, usually caused by overdose or chronic high doses. The potential impact is this: taking too much paracetamol can lead to acute liver failure, especially when combined with alcohol. Paracetamol can cause skin reactions. Some people develop rare allergic reactions to paracetamol. Conditions like Stevens-Johnson syndrome, which are severe skin rashes. Blood disorders are another rare side effect of taking too much paracetamol. Paracetamol has also been linked to conditions affecting the blood, like low white blood cell count, also known as a granulocytosis. The lesser-known harmful effects of ibuprofen can include stomach ulcers and bleeding, most important, caused by long-term use or taking ibuprofen on an empty stomach, which can cause gastrointestinal bleeding, stomach ulcers, and perforations. Ibuprofen has been known to cause kidney damage through long-term use or high doses. Ibuprofen can reduce blood flow to the kidneys, leading to kidney injury or failure, especially in people with pre-existing kidney issues. Heart problems have been associated with ibuprofen, caused by long-term or high-dose use. This increases the risk of heart attacks and strokes, especially in people with existing heart conditions. Ibuprofen has been known to cause fluid retention, which can cause the body to hold on to water. This can lead to swelling, known as edema, and worsening high blood pressure or heart conditions. Ibuprofen is linked to increased bleeding risk, as ibuprofen has a mild blood thinning effect. Ibuprofen increases the risk of bleeding, especially during surgery or injuries. The key takeaways from the research suggests paracetamol is often safer for most people, especially for those with stomach problems, heart conditions, or those at risk of bleeding. Ibuprofen is better for inflammation but has more risks, particularly for the stomach, kidneys, and heart. In either case, taking the recommended dose and avoiding long-term use without medical advice is crucial to minimizing risks. Always consult a healthcare provider if unsure. So what about dosage recommendations? Here are the typical dosages and time intervals between doses for paracetamol and ibuprofen. Starting with paracetamol, the usual adult dosage: 500 mg to 1000 mg, 1 to 2 standard tablets per dose. Maximum single dose is 1000 mg or 1 gram. The usual time between doses is every 4 to 6 hours as needed. The maximum daily dosage would be 4000 mg or 4 grams in 24 hours, usually a maximum of 8 tablets at 500 mg strength. Important notes: overdosing on paracetamol can cause severe liver damage, so do not exceed the daily limit. Always check other medications to ensure they don't contain paracetamol, as it's often combined with other drugs. Let's now look at ibuprofen dosages. The usual adult dosage is 200 mg to 400 mg per dose. The maximum recommended single dose is 400 mg for over-the-counter strength. The time between doses is every 6 to 8 hours as needed. The maximum daily dosage is 1200 mg for over-the-counter use to 3200 mg under doctor supervision for stronger prescription doses in 24 hours. Some important notes include taking ibuprofen with food or milk to reduce the risk of stomach irritation. Prolonged use at higher doses increases the risk of gastrointestinal and kidney issues. In summary, paracetamol, every 4 to 6 hours, up to 4,000 milligrams per day. For ibuprofen, every 6 to 8 hours, up to 1,200 milligrams per day, OTC, or 3,200 milligrams, as prescribed. Always follow the instructions on the medication packaging or your doctor's advice for safe use. So can paracetamol or ibuprofen kill anyone who takes it? This can be answered in the context of overdose and chronic abuse situations. This does not refer to regular consumption. Like anything, if you choose to go beyond recommendations, you risk putting your health in jeopardy. The death rate from paracetamol abuse is notably higher than that from ibuprofen abuse, primarily because of the severe impact of paracetamol overdose on the liver. Here's a general comparison based on available data and known risks. With paracetamol abuse, potential liver failure. Paracetamol overdose is one of the most common causes of acute liver failure worldwide, and even a slight overdose can result in severe liver damage. The death rate. In the United States, paracetamol-related overdoses account for approximately 500 deaths annually, according to the FDA. In the United Kingdom, it is a leading cause of liver failure, responsible for over 100 deaths per year. The toxic dose is often cited as 7.5 to 10 grams in a single intake, which is about 15 to 20 standard 500 milligram tablets. But liver damage can begin at lower doses in people with certain health conditions. Why it's dangerous? Well, paracetamol is often perceived as a safe over-the-counter drug, so people may unintentionally take too much, especially if using multiple medications that contain it. Now, looking at ibuprofen abuse, patients can develop gastrointestinal and kidney complications. While ibuprofen overdose can lead to gastrointestinal bleeding, kidney failure, and cardiovascular complications, it is less likely to result in immediate death compared to paracetamol unless taken in massive amounts. Deaths from ibuprofen overdose are far less common. Exact figures are harder to determine but are considerably lower than paracetamol. Most ibuprofen overdoses result in hospitalization rather than death due to the slower progression of severe symptoms. Death from ibuprofen overdose is rare, and when it occurs, it's typically related to very high doses, greater than 3,200 milligrams per day for extended periods or acute doses of more than 100 tablets. Why it's less fatal, you may ask. While dangerous in high doses, ibuprofen's risks for kidney failure or gastrointestinal bleeding typically manifest over time rather than as sudden life-threatening conditions, which gives a window for medical intervention. Comparison of the two drugs. Paracetamol poses a higher and more immediate risk of death due to liver failure, especially with accidental or intentional overdose. Ibuprofen carries risks of gastrointestinal bleeding and kidney damage, but is less likely to lead to death unless taken in extreme amounts over time. The key takeaway would be, paracetamol has a higher death rate from overdose, with hundreds of fatalities reported annually due to its severe effects on the liver. Ibuprofen overdose is typically less fatal, but it can still lead to serious complications that require medical attention. Paracetamol is considered safer than ibuprofen when used correctly for a few important reasons, despite its higher death rate from overdose. Here's why. Paracetamol has fewer side effects at recommended doses. It is gentler on the stomach. Unlike ibuprofen, paracetamol does not irritate the stomach lining, so it's less likely to cause stomach ulcers, gastrointestinal bleeding, or acid reflux. No kidney issues, as paracetamol does not reduce blood flow to the kidneys, making it safer for people with kidney problems, whereas long-term or high-dose ibuprofen use can lead to kidney damage. No cardiovascular risk, in that paracetamol doesn't carry the same risk of heart attacks or strokes associated with prolonged ibuprofen use, particularly in people with pre-existing heart conditions. Ibuprofen's risks increase with long-term use. The cumulative risk of ibuprofen, especially in high doses over long periods, increases the risk of chronic kidney disease, stomach ulcers, and heart problems. Even at over-the-counter doses, extended use of ibuprofen can result in these serious health issues, while paracetamol is safer for long-term use as long as dosage limits are followed. Paracetamol overdose is more preventable. Paracetamol overdose is well documented, and people are generally aware that they should not exceed the recommended daily dose of 4 grams, 4,000 milligrams. This awareness helps prevent accidental overdose in many cases. The toxic dose threshold shows us. It takes several grams of paracetamol to reach toxic levels, meaning people usually need to intentionally take many tablets at once to risk liver failure. With ibuprofen, complications can occur even within the normal dose range if used long-term or for people with certain health conditions. The high death rate from paracetamol overdose is usually intentional. Paracetamol is safer for acute use in treating pain and fever when taken correctly. The higher death rate is often associated with intentional suicide attempts or large, unintentional overdoses, e.g., taking multiple medications with hidden paracetamol, not typical everyday use. Ibuprofen's deaths are rarer but linked to chronic misuse or long-term overuse, which can cause kidney failure, stomach bleeding, and heart attacks over time. Why paracetamol is still considered safer? When used correctly at recommended doses, paracetamol is less likely to cause serious side effects than ibuprofen. The danger of overdose with paracetamol can be mitigated by staying within the recommended dosage, while the risks with ibuprofen can build up even at normal doses over time, particularly affecting the stomach, kidneys, and heart. The key takeaway suggests paracetamol is generally considered safer for short-term pain and fever relief because it lacks the stomach, kidney, and heart risks that come with ibuprofen, especially with long-term use. However, paracetamol overdose is dangerous and can lead to liver failure, but this risk is avoidable by sticking to the recommended dosage. So in conclusion, when should I take these medications? Paracetamol is a good choice for general pain and fever relief, especially in individuals who cannot tolerate non-steroidal anti-inflammatory drugs or have gastrointestinal sensitivities. Ibuprofen is ideal when inflammation is a component of the pain, but should be used cautiously in individuals at risk for gastrointestinal or kidney issues. We hope this video has helped educate you on paracetamol and ibuprofen, so the next time you reach for the medicine cupboard or pharmacy shelf, you will feel more comfortable with your choice. Please like and subscribe if you enjoyed this video.